Okay, so I apologize for the fuzzy picture, it's low resolution, but it's a morning session. You just had breakfast. I don't know if your caffeine has hit in yet. We're right in the French Quarter. I had to capture your attention, and funny dog photos do the trick. But I'm not going to be talking about dogs. I am going to be talking about climate change and what that means in terms of extreme temperatures, primarily heat, and what that means also for a segment of our population, older adults living at home. Also, because of the time limitations, I'm often going to make some sweeping, broad statements. I know things are much more complex. There's nuances, there's particular cases, like Eric says, it depends. I know that's the case. Please feel free to ask me about that, draw out any particulars afterwards, but it's just because of time limitations, I can't go into all the details. This is just a map of places that I personally have lived in, anywhere from 3 to 22 years of my life. So you can see that just personally I'm familiar with a lot of different climate contexts in the United States. The mild marine context, hot and arid in Phoenix, Arizona, hot and humid in Gainesville, Florida. But I have lived in Milwaukee as well, so I know what a cold climate is like too. And that also has health consequences, but I'm not going to be addressing those here. This is a satellite view of Superstorm Sandy. And if you remember, it was called Superstorm because there were three extreme weather conditions that collided at the same time in the same place. I see also another superstorm coming in the next couple of decades because of three major systems also colliding at the same time and in many places across the globe. The first one is climate change, and I don't know, I have to go into a lot of the detail here at this conference, and especially with Mona sort of introducing it as well. But again, that's going to mean extreme weather conditions and also predictions of not only global warming, but increased air temperatures, what that implications are. The second one is what I call demographic transformations. It's not just strictly what is a phrase of the silver tsunami, which I hate, but it's not just in terms of the larger number of older adults we're going to have across the globe, those numbers. I could give you a whole bunch of numbers for that, but one of the things I want to emphasize is that it's the transformation of the demographics overall. We're going to have age tilts in many of our countries that we've never experienced any time on this globe. In less than 15 years, we will have more people over the age of 65 in this country than we will have kids under the age of 18. If you don't believe this, go to Sarasota, Florida, and you can see there are more people over the age of 85 than there are children under the age of 5. We have never had that age tilt. We have never built our buildings or in our communities. We have never established standards for thinking about that kind of age tilt. And for us, when we're also thinking about buildings, and particularly a lot of people here are concerned about homes and residential energy and the environment of the home, 1 out of every 3 households will be headed by somebody that's 65 years and older in less than 15 years. So, those are transformations. The third thing I want to talk about is healthcare needs and costs. Again, there's a lot to that. They have whole conferences on this. One of the things that we are seeing in terms of trying to address these healthcare costs is decreased hospitalization. And one of the ways of doing that is we see more and more healthcare happening in our homes themselves. And slowly over time, we are going to be seeing our homes as healthcare settings, whether it's long-term or acute and short-term as well. Another transformation with this is this chart, which I always find striking. When you read the title, Per Capita Healthcare Spending Skyrockets with Age, we go, duh, we really didn't need science for that. Or when we look at those blue bands, of course Medicare is going to be increasing when we get older because of its entitlement at a particular age. But I want you to look at that orange band around the bottom. Out-of-pocket healthcare costs. You see it beginning to grow around 75, and it peaks at 85 years and older. Now, I don't know about you, but my income-producing years are not going to be 85 years and older. That is when you are usually on fixed income. For many people, they had gone through a lot of their savings. They didn't know they were going to live that long. They didn't know what the costs were going to be for retirement. It's not the time where you really have a lot of income to be spending on health, and yet that's where the bulk of your out-of-pocket costs for an age cohort will be in that 85 years and older. So again, all of these things are happening at the same time. Now, most of the public focus when we talk about global warming, or we talk about extreme weather conditions, particularly of heat, most of the, if you look at the sort of the research articles, as well as a lot of the public attention, focuses on heat waves, extreme temperatures for an extended period of time, outdoor temperatures, and mortality. And those are really important. I mean, I think many of us in this room remember 2003 in Europe, where they had extended heat waves across many countries in Europe, and there were tens of thousands of people who died or suffered from those extreme heat waves. However, I want to say that there's also, the problem is more than just heat in terms of heat waves, and it's more than just death. That's an important thing, but there's other health conditions also we have to consider for that. And so there's two things that I think in terms of widening our vision on this is chronic indoor air temperature conditions, whether it's heat wave related or because of other purposes, other reasons such as fuel poverty. And also other health impacts that we know that are associated with elevated heat or extended heat periods, particularly indoors. Pulmonary conditions, cardiac conditions, respiratory conditions, and things that sometimes we don't bring to the surface as much, although the research also demonstrates its correlates with behavioral health and particularly sleep. And we know sleep is increasingly seen as so key into our immune system as well. So these are things I think we need to bring more attention to, as well as more research focus. I'm not going to go over this, these slides right here. Just suffice to say that was a study that I and a team did in Phoenix, where we did some minor green retrofitting, energy efficiency retrofitting. We found decreased in extreme temperatures indoors in these people's homes. It was a pre-test and 2 post-tests so that we could look at it. But we also found, even though it was self-reported data, outcomes in increased hours of sleep when there was a reduction in extreme air temperatures inside the home, as well as reduced emotional distress. So why think about aging? Well, there's a lot of, and again, there's a lot of diversity in terms of people as they age, in terms of physiological conditions, but the body does react in a particular way of your thermoregulatory system doesn't operate as well. Think of yourself as that as sort of your internal thermostat. Just like any thermostat in a house, over time it doesn't operate as efficiently, it doesn't click in as much as it should. The same thing is happens with our bodies as we also age, and the lower metabolic rate as well as cardiovascular systems. But also we have to think about living patterns. We've heard at this conference over and over again that we spend 90% of our time indoors. Older people spend that too, 90 to sometimes 100% of time indoors, but also they're sedentary. They're the most sedentary age cohort we have. So they tend to not be very active, and again, that has a lot to do with general health, but also this is a population with higher use of pharmaceuticals. And some pharmaceuticals also elevate your body temperature, and then when that mixes with an elevated heat, whether that's indoors or outdoors, you can have a lot of these disruptive health patterns as well. Also, a lot of older people live alone, and social isolation is a major concern among a lot of older adults, and we've seen correlates of that with many of these instances of high mortality and heat waves, as well as other studies as well. And I'm not going to go into all of these. Again, it's complex, and there's some real interesting ways in which these three storms begin to weave together. And I just want to give you one example. A lot of this, some of the studies that are being done now, particularly in Europe, are looking at older adults with heat, indoor heat, with older adults with dementia. Now, just to think about this, of how it relates, with people with dementia, particularly in the later stages of dementia, there's a lot of more use of psychotropic drugs and medications that elevate your body temperature. When you're in higher indoor air temperatures as well, one of the responses that they've been noticing with people with dementia is increased agitation. It's one of the ways they react. They're trying to understand why that is, because the cognitive neurological system is different. So instead of thinking about sweating, a lot of them are becoming increasingly agitated. What happens with that? If you're in a memory unit, a nursing home where there's other people with dementia, you see somebody with agitation, and there's sort of this ripple effect that begins to happen as well. Also, you have healthcare staff there who are, frankly, usually overworked, understaffed, undersupported, and they have to also work with a much more increasingly agitated population. Sometimes what happens is more pharmaceuticals are given as the answer to that. And so we begin to see how, if we're not really clear about how the environment also plays a role in all of this, that it just sort of double downs on some of the health effects too. And I don't mean just the people, in this case, people with dementia, but also the care workers who are working with those people as well. So again, the ripple effect and the complexity. So is our housing stock ready? Switching to a different way of looking at this, and I'm just going to run through these really quickly, but these are things that we need to consider. And as Steve said, it's really time that we really begin some more serious and extended conversations and research on this. And I think that what we have done to date is really good platforms for saying how we need to go forward. So some of the things, when I talk about this, people say, well, the answer is just having more air conditioning units. Well, in the United States, 90% of the homes that we have some form of air conditioning, whether that's a room unit or a forced air conditioning unit. And they have been instrumental in cutting premature deaths in terms of heat waves. However, we also know what that means in terms of emissions and what that means in terms of global warming. And we also know that just having an air conditioning unit doesn't necessarily guarantee efficiency nor of the units itself, nor its applicability in terms of keeping heat down. Routine maintenance. It's not just putting it in, it's maintaining it, sustaining it in a proper way over time. And then, of course, they depend on energy sources, and we have power outages because of a number of weather conditions, and this is, again, predicted to increase with climate change. In Florida, after Hurricane Irma and the recognition that about a dozen people died in nursing homes because there was no backup generators or backup energy source for a power outage where it knocked out all of the air conditioning units, the response was, okay, a regulation statewide that every nursing home and every assisted care facility had to have a backup generator. And that's a good response. Okay, this is one of the initial responses. But we have to recognize that only 5% of the people over 65 live in nursing homes. When we look at people over the age of 85, it's only 15%. So what happens to these older people who aren't in those homes that these regulations aren't going to cover? Skipping through these more quickly too, we know a lot. The architecture and the engineering community, the design community knows a lot about passive and non-mechanical features to also increase airflow and humidity, control humidity a little bit more and other things, but we don't implement them as much as we should. Urban heat island effect. I know some of you in the room may know about this, what that means, and some of you may not. But as we increasingly densify on this globe, that's going to become another area in which we will have higher air temperatures, not only in the daytime, but in the nighttime, and it doesn't cool off. And living in Phoenix, I know that quite well, how miserable that is. And social connectivity, we don't often think about that. But also, again, how our environment can foster connections with other people around us, and building social support systems is really important. And we've seen this not only in heat waves, but we've seen it in other conditions with older people and health. And I want to thank you, and I think I've reached my time.